Hello, everyone. Thank you so much for joining us today. We are going to be talking about influenza in babies and children. My name is Sarah Hunstead. I'm a paediatric nurse, a mum of two, and founder of CPR Kids. And I am joined today by Dr. Paula Lister, who is the medical co-lead of the Queensland Paediatric Sepsis program. But I think, it'd be much better if Paula does her introduction because, you've got such a wealth of experience. I'm so grateful that you are coming to talk to us today. So please, Paula, tell us about yourself.
Well, Sarah, first off, thanks very much for having me. So sepsis is close to my heart, but I think what got me into sepsis was actually influenza. So influenza has always been a very big topic for me. So I was in a big ICU in London when the original pandemic with the H1N1 happened. And I was fortunate enough to be able to report on the first cases in children. And as a result of that, I ended up being a WHO advisor and consultant for them. And I've been teaching in wonderful places all over the world, helping clinicians to treat severe influenza in children because it is a potentially very serious disease. So I've managed to travel the world, meet some wonderful people, and at the same time improve our ability to treat influenza. Yeah, so absolutely. It's very dear to my heart.
Well, I'm so excited that you're here because the other thing is everybody who's tuning in at the moment, please feel free to ask questions. It's, we've got such an expert in Paula here. Make sure that you pop them in the comments below because it's not very often that you get someone with this wealth of experience to be answering your questions. So mind you, that is while we are live. If you are watching the recording of this, please, unfortunately, we can't answer your questions afterwards, but if you're live on now, we would absolutely love to. So I'm coming to you today from Gadigal country, and we would love to know where you are tuning in from as well, because I am, certain we get people in from all over the world, not just Australia as well. So please let us know where you're tuning in from. So I guess we should probably start at the beginning, and the most sensible place to start with is, Paula, can you actually explain to us, what is influenza?
Well, it's interesting because it's a word we often use in our common language. We talk about having the flu. And generally speaking, we mean a common cold by using that language. Whereas actually influenza, even if it's a completely uncomplicated course, is actually a more serious infection than that. So typically once you've contracted the disease, you've met somebody with influenza and you've breathed it in and become infected, it takes about 2 to 3 days before you become symptomatic, and you're probably shedding that virus. We're all much more aware of viruses now that after the pandemic, but you're probably shedding that virus about 24 hours before you've actually developed symptoms, which means that you can be spreading it around without knowing it. And then over the next 24, 48, possibly 72 hours, you'll have your majority of your symptoms, and then they will disappear. And during that symptomatic phase, you really are shedding a lot of virus. And then typically by the end of a week, you'll probably be back to normal. Right. And that's the simple, uncomplicated course. Now, as I said, it's not a common cold. The symptoms can be fairly severe, so very high temperatures, often well over 39 degrees and over 40. And if you're an adult, adults will often say they haven't felt that sick before. It's awful. And so if you're a child and you don't actually even have verbal skills at that, if you're that young, that can feel awful. So fevers, chills, and shivering. Fatigue is a big part of this. People feel very tired and very fatigued. Again, difficult in children. So often they will be more listless than you're used to. They may be sitting on the sofa when normally they'd be zooming around and not wanting to play and do their usual things. So much more fatigued than normal. And then
how did that come out in babies? So obviously babies who are sleeping, a lot more than a toddler would be. How would you be able to, establish that fatigue with a baby?
It's difficult, and that was what I was going to come to. That actually in the younger age group, it's actually quite difficult to find these symptoms out, and they present slightly differently. So they may be sleeping more than usual, as you would say, sleeping through, not waking up for feeds, that kind of thing. And then there's respiratory symptoms, so the sort of runny nose, the sore throat, a bit of a cough, that that is common. And in the older kids, they'll complain of headaches and just muscle aches and pains. Now, again, in your smaller kids, they can't tell you that. So they may be just more irritable than usual, maybe have unexplained pain, keep saying that things are sore, but they can't actually point to where it's sore. So it's kind of undefined in that way. And the younger kids, again, particularly the under 5s, tend to have more gastrointestinal symptoms than older kids would, or adults. So vomiting, diarrhea can be a big symptom. So those are the sort of commoner ones. Now, in order...
I'll just stop you there for a sec, because I think that this is one of the biggest questions that we get from parents, and I think you've just really highlighted this, is how can you tell the difference when they are becoming more sick, whether it is just going to be the common cold or, a virus that perhaps isn't going to make them so sick versus the flu. So you're talking about that really high temperature, those muscle aches and pains, and that vomiting and perhaps diarrhea. Is that a good... looking out for those signs, is that a good way for a parent to actually be that red flag going, oh, it might be the flu rather than just a cold?
Absolutely. So those things definitely are red flags. And I actually think about red flags as even more severe than that. So to me, I think about a red flag as, when do I need to go and get help? When do I need to call the doctor? When do I need to take my child to hospital? So for me, the red flags are more about, this is really something that I haven't seen before, or my child hasn't been this sick before. So the red flags for me around the temperature. So as I said, we expect the temperature to come and be there sort of 48 hours. If it goes away and comes back, red flag. Okay. If it doesn't settle, if it seems to just be going on for too long, that's a red flag. There's something not quite right about that. And we also know with high fevers that particularly young children under the age of 5 can have febrile convulsions. So that would be a red flag for me. And we know that of the kids who are hospitalized with influenza, 5% of them actually have febrile convulsions. So it's a common thing with influenza. So obviously, even if your child has had febrile convulsions before, it would be a reason to be going into hospital and getting checked out. From the fluid perspective, if you've got a high temperature, you're going to be burning off fluid, you're going to be sweating it out. So your kids actually need more fluid than they normally would. So if they're lethargic and not wanting to drink enough, and you notice that their urine output is going down, so fewer wet nappies than normal, red flag, you need to take them in, because they're actually just not managing to keep up with their fluids and they're becoming dehydrated. So those are the sorts of things for me that are serious. One of the complications one of the commonest complications of influenza is actually pneumonia, which is a chest infection. It's when it drifts down into the lungs. And children with pneumonia will be breathing fast and look like they're really struggling to breathe. The work of breathing is going up. So if you notice that that's happening, definitely to hospital with them. And smaller babies, so sort of under 3 months, under 4 months, they may actually have long pauses in between their breathing. So you'll notice that they breathe, and then there's a bit of a pause, and then they breathe, and a bit of a pause. Big red flag, straight into hospital with that. So those are the sorts of things that I look for. And when it gets to the level of consciousness, now we expect them to be a bit lethargic in this, but they should still be alert. It should still make sense to you. If they're becoming confused, or you're finding it difficult to rouse them, or they just won't feed and they're really floppy, into hospital with them too. Immediately. Those are the big red flags, because what we're talking about there is something that we call sepsis. So sepsis is when the body's immune system doesn't quite work in the way it should do, and they become a bit dysregulated. And it can happen with any infection. And one of the infections that is known to lead to sepsis is influenza. Yes. So it's that kind of severe end of the infection where the body's just not coping with it. And so our organs aren't quite working quite right. That's when you need help from hospital.
Yep, absolutely. And I think being able to recognise those signs and symptoms of sepsis is really important. And one of the great things is there are such good resources out there that your team have also developed, and I'll be putting a link to those in the comments below. So make sure that you save this post and also pop in the comments below anybody who you think will benefit from this information. So I will pop that down there, and make sure you come back and have a read of that information as well. So Paula, you've talked about
actually just Google, could this be sepsis Queensland, and it comes up with number 2.
Excellent. There you go. Okay, well, that's a good thing. That is a very good thing. Now, we've talked about that sepsis is a complication of a severe influenza. Obviously, not all kids will end up with sepsis, and being aware of those red flags is just something that every parent must know what to look for, without a doubt. But just say our child has been diagnosed with influenza, we're aware of the red flags to look out for, but we're okay to have them at home for the time being. What should we be doing to support them at home?
So I'll break that into 2 sections, if that's okay, because we know that there are some children who may have a higher risk for developing severe influenza than others. And those children are the young ones, so under 6 months of age. In fact, the US stratified, so anybody under 5 years, they say, is at higher risk. Anyone under 2 years is higher risk still. Anyone under 6 months, they consider very high risk. So those are the kinds of ages that we would worry about influenza being potentially more serious. Our Indigenous population, they definitely have a higher rate of severe influenza in the Indigenous population. Children who have chronic underlying health conditions, so for example, asthma, which is very common in Australia, we need to just be a little bit more cautious with them and be seeking help sooner if you see any of those red flags. But then other conditions as well, so neurological conditions. If a child has cerebral palsy or moderate to severe learning difficulties, they often can have worse influenza and potential for sepsis. And children with sort of cardiac conditions who may be on aspirin all the time, they're particularly a group as well that we do worry about. So when we talk about treatment, we're talking about previously healthy children who don't have any high risk factors. Then most of those kids, all we've got to do is, when you keep them at home, watch them. Don't let them go to school or take them around the supermarket because they're busy spreading viruses. So keep them at home, and keep their fluids up. It's not always necessary for them to eat, but if you give them something of, fluids with a bit of calories in, whether it be a feed or a milky thing or a juicy thing or whatever, something with a few calories in, just keep their fluids up because they will be burning off their fluid. And then you can use things like paracetamol or Nurofen to help with the aches and pains and the high fevers. And that's really all you need to do. Now, if they're in that potentially that other group where they may have underlying health conditions, then those children, we would recommend that they actually are also treated with a drug called Tamiflu, which I'm sure you've all heard of, or oseltamivir, because that can reduce the risk of severe disease in those children. And we like to start that early, so sort of within 48 hours. But in that high-risk group, we would start it probably at any time. In healthy children, we can also give them Tamiflu and it'll reduce their symptoms by about a day, but it does need to be really early on. So it's in that time where you're shedding that virus. And this is something we don't often know about because we know all about antibiotics and bacteria. But actually now with COVID, we're sort of learning that antiviral medicines aren't really that effective. And that's because bacteria and viruses are very different things. So bacteria can live on their own and reproduce on their own and multiply and make lots of new bacteria, whereas viruses actually can't. Viruses have to infect your cell, and then it takes over your cell and uses all of your cell's apparatus to make more viruses. It can't do it on its own. So all of the antiviral medicines, we can't kill off our own cells because that wouldn't be good. Those antiviral meds actually stop the cells from shedding that virus. So that's how they work. So they can only really work in that very early phase. So that's why we like to get it in early. And that's why they're not quite as good as our lovely antibiotics, which work to kill off bacteria all the time.
And so in a normal, that's a terrible word, but in a healthy child, it wouldn't be routine to actually be given that by the GP. Is that
not at home? Now, there may be other reasons why they might do that. So say that child lives in a family where there are other people who may have risk factors for severe disease. They might think about giving oseltamivir, for example, in that situation, but it's not usual. It's not usual.
Yeah. Okay.
And so in chronic disease, we definitely would give it to try and prevent them from deteriorating and coming into hospital. And we definitely give it to any child who's hospitalized with influenza.
Yeah, excellent. So what we've done, we've talked about what the flu is. We have, talked about how the signs and symptoms are and how they can differ from the common cold and so on. We've talked about the red flags and also complications of influenza, which of course can be sepsis, and the importance of knowing those red flags and when to go and seek help. We've also talked about, some treatments as well and what to do, the importance of making sure that you keep your child comfortable and hydrated if they are at home. But what about prevention, Paula? How can we prevent the spread of flu? Now, we've talked about staying at home, but we've got a great question here that addresses this. So if one of the parents of a 6-month-old baby gets the flu, should they keep away from the baby until better if possible? Or is it just inevitable being in the same house that you're all going to end up with it?
Oh, I think that's a very, I'm more of an optimist. So I would say if you have good hygiene in your home, so we've all seen how good hand washing and mask wearing and social distancing has reduced influenza in the last 2 years because of COVID being around. So I think if you are at home, keep your surfaces clean. If you're coughing and sneezing, make sure that you dispose of the handkerchiefs and wash your the tissues, wash your hands and so on. I would suggest, if it is possible, to separate from your baby during those really symptomatic periods, it would be better. And I have to say that if you are an adult with influenza, you're going to be in your bed. You're not going to be in any fit state to be looking after a 6-month-old. So if you can separate yourself from the child, I think that is a sensible way forward. And it's not inevitable that they will get it.
Excellent.
It's likely, but it's not inevitable. So I think
there's hope. There is hope.
Okay. And that's kind of the thing I was going to lead on to with the vaccines. We're protecting not just ourselves, but a whole family, and indeed grandparents who are very susceptible to poor outcomes from influenza. So it is important to get vaccinated for influenza, and it's really important for our kids to get vaccinated as well. So there are free vaccines from 6 months onwards and up until they're 5 years of age, and then for those high-risk groups, obviously after that. And for the below 6 months, actually they can be protected if mum is vaccinated in pregnancy, during her pregnancy. And we know as well that when mums are pregnant, they're at high risk themselves from influenza. But there's the added plus of, if they're vaccinated, that they're giving protection to their baby.
Yeah. And Paula, why do we need to be vaccinated every year for influenza?
Well, as I said, we've all learned the language here with COVID. We know that viruses mutate, and influenza A is a master at this. A and B, they have mutated just about every year. There's a new little mutation that comes on. So our brilliant scientists, they try to predict what the next 6 months is going to be, and they put usually sort of four different varieties in the vaccine, and we hope for the best. And if there's a really good match, then your vaccine tends to be more effective than if there isn't a really good match. But that's why you need it every year, because every year the virus has changed, so you need to update it every year.
Okay.
I saw there was another question there that I did want to answer.
We do. It says, if your little one has had the flu, can they catch it again, even in the same season? Can that happen?
And that's a very definite yes, because there's so many slightly different strains out there. And that's why our vaccine has prevention against 4 different strains. So you could get all 4 strains in 1 year. So
Yeah.
absolutely you can get it again.
There you go. Thank you for that.
I really don't want to.
Yeah, I think a lot of people feel like that once they've had the virus, we're armored, we're invincible, and you're not going to catch it again. But yes, exactly. Now we have. Now this is something that we are asked so often at the moment, and I love how this one is phrased. So Yolanda has said, "So what's all this with small children getting sick?" We are asked this all the time at the moment. It feels so much worse this season with all of the illness around. Is there more influenza than usual that we're seeing?
There's more influenza, there's more RSV, there's more HMPV, there's more rhinovirus, and there's more COVID. So those are the 5 that we are seeing every day in my hospital.
Mm-hmm.
And the reason there's more of it about is because, and compared to last year and the year before, we were in lockdown, we weren't circulating, and when we were staying further apart, and we had masks on, and we were washing our hands. So the viruses didn't have a chance to get in and infect us. And now they're getting this chance. And the smaller kids obviously have never met any of these viruses before, so they're getting them all at once, and they're very helpfully bringing it home and giving it to their siblings, and very helpfully sharing it with mum and dad and everybody else too. So it's a bad season. It is a bad season, and we are seeing lots of children hospitalized at the moment, which is what we want to avoid. And I think maybe that's something I didn't mention with the vaccines. They are not 100%. If you have a vaccine, it's not 100% that you're not going to get influenza. You may still get influenza after a vaccine, but it's a bit like COVID. We know that even if you are infected, then you're much less likely to have severe disease, so much less likely to end up in hospital or in an intensive care unit.
So there is still that protection.
There is still that protection, yeah.
Excellent. All right, very good. Now, the other question that we have is from Fiona. Now, Fiona has said that she's an adult survivor of sepsis and parent of an 8-year-old, and she's been very involved in advocacy for sepsis. That's fantastic. And she's also baffled by the lack of education and awareness and about the signs of sepsis, yet so many parents educated about and aware of meningococcal. And this is something that we certainly see in our classes as well, that a lot of parents are certainly aware of that, but aren't aware of, that sepsis can be caused by other things. And for a start, that's why we're here today. We're here today to help spread that awareness and the fantastic resources that, the Queensland Sepsis team have developed, which I will be putting in the comments below. Or you can Google for the Could This Be Sepsis on the second one, which is a pretty good ranking. But Paula, what's your opinion with this? How can we, be spreading this more around as well? What are your thoughts?
Look, I think it's a tricky one. So things like meningococcal disease was so devastating and so in your face with this big rash and everything there was a lot of advocacy and charity work around it, so they managed to get the message out. It's a little bit less easy to talk about sepsis from any cause. We talk about the classic for me is COVID. COVID causes sepsis. All these deaths we've had from COVID have actually pretty much all of them, some haven't, but pretty much all of them have been because the person has become septic. They have sepsis. It's just that their sepsis was caused by COVID, but we all in our heads and the way it's portrayed in the media have separated that off as being, oh, that's COVID. And now I'm talking about influenza. Now that's also different. And, if you have meningococcus, that's different again. It's not. And it's just the way we've been messaging it is incorrect. It's an infection, and all of them feed into sepsis if the body responds in a certain way, which is what's happening. And what we've got to do is just be teaching how to spot that. And most parents know this stuff instinctively. They just haven't been taught it formally in any way, and that's what these resources are about. And it's about trusting your instinct. Every parent I have talked to who's ended up in my ICU with a child with sepsis has said, I went back to the doctor twice. I felt bad about going back again, because they said everything was okay, but I could see it wasn't. And it's that, that you trust your instincts. Your child's behavior, and then in the early stages, it's actually about the child's behavior. I said to you, one of the signs of influenza is listless. I don't know your child, but if your child's normally zooming around on a little bike outside and you can't even ever get them in to sit down and have a meal, to have them lying on the sofa is completely abnormal. Whereas
Yes.
that's how I see kids when
Yeah.
they're all lying on a sofa. So we really need parents' input into, this is different for my child, that I have never seen my child like this before.
Yes.
And the way to communicate that is a question. And the question is, could this be sepsis?
Yes.
And that's what we need to be educating parents. And we all have to do it. And these groups are great because we're informally teaching lots of people, and I'm hoping that you'll go away from here and be teaching your friends and, you know,
Yes.
your groups over coffee in the morning and have you heard of this and check out this website, because unless you guys are educated, we're never going to get the kids to me, and then I can't do my job.
Yep,
And I don't
exactly. That's it. That's exactly it. And so we'll really be diving into this as well next week, where we're going to be chatting with Alana English as well from the Queensland Paediatric Sepsis program, and we'll be talking about how to advocate for your child as well when you feel like that perhaps that things aren't going right. You're worried about them, but you're not sure about, going back to the doctor and so on. So make sure you tune in next week to have a look at that too. But we have had another question. So from Casey, and Casey has said, how do doctors confirm that it is influenza A? So how do we test that in kids?
There's usually sort of two ways. One is a little swab we stick up the nose and we send that off for PCRs, which you're all very familiar with COVID. So it's the same sort of test. And actually we do it all on the same test at the moment, something called a gene expert that gives you COVID, influenza and RSV all together in one shot. And then there are other tests around called rapid antigen tests. You all know about rats for COVID, but we don't tend to use those for influenza because they're pretty unreliable, just as they are unreliable for COVID. So, if it's positive, that's useful. If it's negative, well, it may still be positive. So we don't tend to use that. So it tends to be a little swab up the nose.
Okay, excellent. So before we finish up today, Paula, is there anything else that you would like to say about influenza and sepsis? What do you want? What's the number one thing you want parents to know and carers to know?
Influenza isn't flu. Influenza is it's a serious infection. So pay attention to it and monitor your child. It's I have seen children die from influenza and sepsis, and I'd rather that hadn't happened.
Yep.
So pay attention.
Yep, absolutely. Know those red flags. That's one of the most important things that you can do. And please share this around, share this with everybody that you know, because, it's about getting that education out there. That's, essentially it's how lives are saved is by the knowledge of what to look out for and getting it early. So please do that. And please tune in again next week. Jump onto the CPR Kids page and you will see our event there. Make sure that you do like that, because then you'll get the notification that it's about to happen. And Paula, I can't thank you enough for your time and your expertise. Hearing from you today as you've clarified so many things. You're incredibly articulate and obviously passionate about this. So thank you. And in the comments as well, there are lots of thank yous coming up too, and particularly from Fiona, being a sepsis survivor, as also thanking you for your hard work, for your advocacy for sepsis. And so same extending from us. So thank you for joining us today, everyone, and we will see you again next week. Okay, bye everyone.
Thanks.